Today we want to talk about some of the PPE we have in our stations to be able to respond to potential flu cases and also the COVID-19 virus. This is some preliminary videos just to make sure that we're all on the same page as we start to get the equipment out and into the stations and make sure everybody's donning it and doffing it appropriately. Now there'll probably be some follow-ups to that. This is, like I said, just-in-time video, just-in-time training. We're trying to get this out to everybody. So bear with us and we'll give you updates as we need to do it. First item we're going to look at is gloves. We're going to make sure that we have at least 2 pairs of gloves with us. These are, again, supposed to be put in a Ziploc bag or a personal protection kit that you can make based on our sizing. And our recommendation is that you have 2 gloves with you. One standard size glove, and you may want to go up in size for the other glove just to accommodate dexterity and the things you'll need to do while wearing them. The N95 mask, everybody should have one of these available to them. We do have some on the apparatus. I would also place one in your personal kit, have it with you at all times. As we go through the current events, things may change on a regular basis, and we need to understand that we may not have enough of these to go around, so we want to make sure that we use them somewhat sparingly. And again, I don't want to preclude anybody from using these if you absolutely think you need to need them, or we have patients that meet the criteria of being infectious or potentially having COVID-19. So don't hesitate to use them, but understand in the background that these are going to be fairly limited to get in the future. I heard some information it could be up to 3 weeks to be able to get these. We do have some on order, and the question is we don't know where they're at, but they are on order, and we'll do the best we can with what we have. Goggles. Goggles provide higher level of protection than the safety glasses that were initially issued. You're welcome to keep those for other types of activities the department does. I would encourage you to keep them with you. Extrications, other activities that we engage in where we have a potential for eye injury, make sure you keep them with you. But these are what we want to start using on patients that we believe are potentially infectious, have been in or could potentially have the flu virus or the COVID-19 virus. These are liquid tight. They do have vents on them, so they shouldn't fog up. They're going to be a little bit uncomfortable, but I think for the limited amount of time we're going to have on, I want to make sure that this is the level of protection that we're wearing. Again, aerosolized droplets in the eyes. Eyes are a tremendous opening to allow for those types of things to enter into the body and create an infection. One other point I want to make about the N95 mask, you need to form fit these. Everybody's been fit tested before on a different type of mask. These are very similar to the same rating. Just understand that there is a nose piece that has to be fit to make sure that we're sealing off what we can. The other part of our ensemble here is going to consist of these boot covers. These are kind of new. Anybody's made packs earlier in the last week and a half. These were not part of that. Doing some further research and finding that these were available, we find that these are going to probably be pretty good for at least the bottom of our boots, our street clothes, our uniform boots, and for most of the tops of them to prevent any type of, viral-laden aerosolized particles that are coming out of a patient. So these will protect their feet. If you know anything about leather, it's very difficult to decon, and those are the things we want to try to avoid. We want to decon. We want to use our equipment as a barrier. Again, the biggest thing with all of these viruses is time, distance, and shielding. So when we talk about time, distance, and shielding, we want to think about let's minimize the time we're in there being potentially exposed. Let's minimize the distance or maximize the distance between the patient and what we're trying to do. And even assessments, we have to give some pretty good consideration to how far we're going to assess a patient based on the level of risk and the exposure that we could have. Time, distance, shielding. PPE is the shielding part of this, and we want to make sure that before we enter these environments or suspect environments, you get dispatch information that suggests you could have a patient that is positive for any of these viruses. We want to make sure that we don this prior to entering, I would say, the front door, the back door, however you're getting into the structure. We want to make sure that that's available. So we've got our gloves, N95 mask, goggles, boot covers, and the last part of this ensemble is actually the Tyvek suit. Per the Region 6 Healthcare Coalition, this provides adequate protection for separating us or shielding us from the bacteria, not the bacteria, but the viruses that create or cause the common flu and also the COVID-19 virus. 2 ways to wear this suit. Again, I want to talk a little bit about why we elected to use a coat or a lab coat style. Most healthcare or clinical healthcare professionals are utilizing a gown. Those tend to be long, and again, there is a portion of our pants that may be standing out, but if we minimize our distance and cover the upper part of our bodies, we have good eye protection, our mask and our shoes, we should be in good shape. Some of the factors that played into this were accessibility, the ability to get various sizes, and also to provide for that variation of fit. If you wear a large coat, Yeah, in one call, it's not going to hurt you if it's too big. Suits are very cumbersome, and you can always find we may end up tripping and falling. So time was also a consideration. We wanted to make sure when we put those suits on that we could get them on quickly so we could get our interventions going and so on. This suit can be worn two ways, or this jacket or coat. We'd like to see people probably try to attempt to wear them backwards. And the reason we want to do that is, one, this is the only PPE that we have that's available for us right now other than suits. And we have a large seam in the front, or opening, that we want to try to protect. So if we can place that in the back, that's going to minimize our potential for exposure and potential aerosolized particles getting into the suit. So the idea is if you can tolerate it wearing it backwards, it's going to require us to use the buddy system, which we should be doing anyway before we enter a space. That's what we want to do. So we'll try to put it on backwards. If you are going to wear it front ways, we will have duct tape available. I would recommend you snap it up and place some duct tape to seal the front up. That's an extra step. I think if you can get by wearing the suit backwards, that's probably going to be the best way to approach it. Some of the protocols we're looking at are going to look at how we address some of our patients. You may only find that one responder is actually suiting up and going into the space unless it's needed. There'll be more to come on that. And just to make sure that everybody's on the same page, everybody on the scene should at least have this stuff available to them, and then decide who's wearing what and go in. Buddy system, getting dressed out, making sure we cover what we can, double set of gloves. And the last part of this we do want to talk about is once you've doffed your material or your PPE and you are preparing to clear the corridors, we want to make sure that you decon appropriately and you doff this PPE. So we're going to go through a process here when we get somebody, we're going to actually dress somebody out and we'll go through the donning and doffing. We do have a bag in the kits, the Ziploc bags we talked about earlier. This will be where you'll put all your materials. The goal with this is to leave this on scene or provide it to the ambulance, put it in the ambulance where the patient is going to dispose of it in their waste. We do not want this back in the station. We do not want people having PPE on, getting into the apparatus to come back. This all has to happen outside, preferably maybe on a front porch or out of the area, out of the view of the public, and certainly away from our apparatus. Any bags, anything like that, we're going to have to make sure that those are decon. Again, per the directive that went out, we want to make sure that staff or firefighters or personnel aren't bringing their bags or any other equipment they need into that environment unless they absolutely need it. Again, we would probably look at trying to assess patients in another location, minimize our exposure. There'll be more on this as far as protocols go from the state of Michigan. As we get out, we're going to basically doff the equipment into this bag. We'll leave it on site. Once that's done, I think it's preferable to get that in an AMR ambulance or a life ambulance for transport for disposal by them. If we do need to, if we can't do that, the ambulance is left, we want to leave it on scene and then mount up on our apparatus and get back here and clear the corridors. Any suspected exposure based on what you're seeing, signs and symptoms, we want to make sure that we do a good, thorough decon back at the station. We're going to designate an area in each station where that can happen. Right now it's probably going to be the mechanics room at the Collin Park station and possibly the rear storage room over at the Waverly station, where we can just get in there, undress, get out of our uniform, get changed into a clean uniform, rather make it to a shower and then change into a clean uniform, and then we'll go from there. But for now, making sure that we do not bring anything back, making sure we're cleaning up before we enter the living quarters and do the best we can there. So decon is going to be really important of any engine, any piece of equipment that goes out on these calls. We're going to recommend wiping off the steering wheels, wiping off any flat surfaces that you may have come in contact with while responding. There is a concern about what we're thinking with our upholstered seats. We're looking at some makeshift aids to maybe protect those seats in the event of an exposure. One of the other things we do want to talk about is what's the difference between exposure and what is just simply being in an environment wearing PPE. An exposure, by definition, is we actually have the infectious substance on us or in a route of entry. Intact skin may not help us on this because we're going to have particles on our face, and if we rub our face, we're going to get into that or get that into our mucous membranes and potentially become infected. So we want to make sure that we document any type of exposure like that. We have a patient that is coughing and you get particulate on your face, it's on your goggles. We want to come back and follow our procedures to make sure that we get that done. So today is a continuation of our PPE awareness. We're going to make sure that everybody has an opportunity to view how the Holland Fire Department is actually going to don and doff this equipment. We've got a number of things here that have talked about, we spoke of earlier in the previous segment. So Kevin today and I are going to actually walk through our expected level of protection and how we're going to don and doff. Starting out, our basic level of protection, there'll be a directive going out soon that basically specifies all personnel responding to any medical call need to have at a minimum their N95 mask and the safety glasses that were provided early on as we started to issue PPE. Kevin's going to don those real quick. Again, gloves, N95 mask, and the safety glasses. What we're trying to do here is prepare for those unknown calls where we're getting pulled into an incident where maybe the dispatch information is not as clear as to what we may have going on inside the building. We've got these available. You get to the door, you start your patient assessment. At least you have a minimal level of protection before you start to get into close contact. And again, that close contact is anywhere between 6 to 10 feet. Recommendation is 6 feet. I would suggest we think about 6 to 10 feet before we approach a patient. Kevin's going to don the mask right now. If I pull both straps over the head, you can choose whether you want to have safety glasses on first or not. We'll find it's probably easier just to do that next. Now it's important to remember these masks need to be press fit around the face in order to get an effective seal. N95 is going to provide the level of protection we need to make sure that we've got at least the primary routes of entry covered. Kevin's got this all set. This is be good as we start to approach the building. If we suspect something else is going on, we make entrance into the residence or the apartment. We start to learn that, hey, this patient doesn't have any of these respiratory issues. They don't have any other medical issues. It's not a cardiac issue. It's not related to the flu or any other type of sickness. We can probably downgrade and pull the mask off. In those cases where there's clearly no potential of exposure to a virus or infectious agent, we can recycle that mask at that time. I'm relying on our people to make the best judgment that they can. If they feel they need to have it on, keep it on. If you do believe it's been exposed, we'll dispose of that through the doffing process and some decon after the fact. Kevin's going to walk through just how to pull that off real quick as we start to see it. Glasses will come off first. Again, if you have any contaminant on your hands, you want to probably change gloves and wash your hands with some hand sanitizer first, and then we'll go from there. See, Kevin is grabbing the bottom strap off the mask. He's pulling it up over his head, and he's going to peel the mask off. What I recommend is we kind of lean forward, and we'll do this later. Kevin's going to don this a number of different times, but we're going to pull that mask off, don it, lean forward, and pull it off. Remember, any potential contamination is going to be on the front of the mask, so we do not want to touch the mask if we can avoid it. Okay. All right. We now are going to move into the ensemble, the full ensemble that we have in front of us. If we determine that this person is a potential of having the COVID-19 virus or even the flu, I think we need to probably step up our protective game here with this PPE. We're going to do that. Going to start out, again, these probably are not adequate for what we're talking about with close contact with a COVID-19 patient, but from a distance and that safe social distance that we're going to start assessment with, these will most likely be adequate. So we're going to start out, again, we're going to arrive on scene. We're going to have a pair of nitrile gloves on. Next thing we're going to do is we're going to start with our boot covers. We're going to go ahead and put the boot covers on first. Think about aerosolization of products, lung or excretions that could be pushed out of the patient. They may end up on the floor. That's why we're wearing boot covers. We're trying to minimize the amount of decon we will have to do after the fact. Okay, the next thing we're going to do, we're going to have Kevin don this. We have a Tyvek coat. This Tyvek coat was selected because of the ease of use, the ability to put it on, and the ability to be able to select various sizes and fit the whole department. Very similar to the gowns that are being used in the clinical setting or the fixed healthcare setting. We are going to don these backwards, however. There's a reason for that. When we doff the material, it's going to be much easier to do it. We're not pulling it off the back of us. We're actually leaning forward and being able to take it off that way. So what I'm suggesting is that we use the buddy system. We're going to have 2 responders. Per our guidance and our system protocols, we want to make sure that we limit the number of people that are going into the building. We're going to have to probably choose which responder is going in. It may be necessary to have both responders don equipment and decide who's going to make patient contact. So we're going to start out right now. assuming that Kevin's going in by himself, going to start the assessment. I'm going to be with Kevin. I'm not leaving Kevin, but I'm going to be in an area that is less contagious or less infectious or potentially less infectious. We don the suit this way. We get that put together. These have snaps in the back, so we'll just make sure we get this whole thing snapped up. We'll probably talk about our game plan, who's going to be doing what, any potential risks. We'll probably reevaluate the patient assessment that we have at the door so we can make good decisions. Right now we need to be thinking about what type of equipment are we taking in? Are we going to contaminate a whole medical bag, or are we just going to proceed in the incident with the minimum materials that we need? Can we stage equipment bags in a clean area and avoid any potential contamination? Those are the discussions you need to be having with your partner. Okay, best we can do. If you absolutely feel like you have to wear this front ways, they're kind of cut different. If you have to wear it around the front, you need to seal the seam. And there is duct tape available to be able to lay a piece of duct tape from the neck down to the bottom of the coat. All right, we do see there's some exposure here. Be on guard for that. From some discussion with the Ottawa County Health Department, they've suggested that if all this PPE is worn and it is doffed appropriately, we should be able to consider ourselves non-contaminated and making sure that our uniforms are not, should not need to be laundered right away. Okay? If there is any suspicion of that at all, our practice and our policy is going to be to make sure that firefighters get that back, change into another uniform. Again, we have a decon area set up in both stations. Those have been identified, and we would simply decon in those areas, launder, take our laundry off, and make sure it goes to the laundry and it'll be taken. Okay, next step, once we have all these items on, Kevin is going to go ahead and don the N95 mask again, and we're going to step up our eye protection now. We're going to go to a full set of goggles. This will provide the highest level of protection, at least around the eyes. We are looking at the potential of face shields, which will protect the whole face. Okay, Kevin, go ahead and don those. The point to be made here, I know there has been discussion about, are there hoods? We do have some that we have available. We're going to have to adapt our PPE to what we need to do. We need to be objective based. Are we minimizing the distance and the contact between our patients? Are we engaging in processes or medical treatments that could aerosolize some of these particles? Most calls we're responding to, we're not going to be doing advanced airways, those types of things. So the potential for aerosolization is probably pretty low. This will be an adequate level of ensemble. And again, as we finish up the ensemble, last thing we want is a pair of gloves. So double gloving is important. It's a step that we're doing that hasn't been recommended. It may be, it provides us an additional level of protection and a barrier between ourselves and a clean glove where we can actually promote our own decon and our doffing of equipment a little bit better. Plus, if we get a hole in that glove, that's something that will assist us. Best practice is to try to get the glove up over there. We have short cuff gloves, so that's probably not going to be possible. There's no problem with that. We're finding the recommendations are that this is going to be adequate. Okay, as you can see, that's everything we should have. Be mindful of proximity to the patient. We have to be mindful of the patient's coughing. Thing to remember, the patient should be provided with a source barrier. That would be another mask, not an N95. Source barriers are in short supply. We're trying to identify a source of surgical masks. We're unable to get those. Recommendations could include 4x4s, anything in our med bag that could be provided as a barrier. If the patient has Kleenex, give them a handful of Kleenex and have them cover their face with that. We need to get a barrier between us and the patient. Right now, those things are in short supply. We don't want to use an N95 right now on them because one, it's hard to breathe through for them if they're already breathing compromised. And the other thing is that those are things that we're going to need. That's a higher level of protection we're going to need for our responders. And again, those are in short supply. So with that said, we're going to get, we're through with the incident. We've exited the area. We're going to go to a clean area, away from our vehicles, away from our apparatus, hopefully upwind, or actually upwind of, what do we want to say, downwind of our apparatus, so we don't have anything moving towards our apparatus. So that's what we want to basically do. Every kit is going to have a plastic bag. What we'll do here is, if I can get the bag open, these are in the party packs. See if we can get this thing open. I'm not going to ask Kevin to do it. So my suggestion is that we take the bag, lay it open, lay it on the floor. This will be very similar to those of you in the hazmat where when we talk about a level B doffing, a lot of times we step into the bag. Don't do that. You could do that, but I think right now we don't want to run the risk of having this part of the garment or this part of our PPE end up touching our legs. Again, if we can take this off appropriately, we're going to reduce the amount of potential contamination in this area and the need to launder uniforms. But again, my position is if you think you need to do that, you do it. We're going to hesitate on that. So where do we start? What we're going to do, having a gloved and protected partner, we're going to assist Kevin in getting out of the garment. The assistant should not touch any part of the inside of the garment. And we're simply going to drape that over the shoulders, hanging that so in a position so that it does not touch your clothing. From the inside out, go ahead and roll that up and just gently put it in the bag. We want to be very conscious of creating any type of airborne particulate, anything that might have dried on there, if there's anything on that that we could bring up into the air. So keep our movements very, very light. Okay, we're going to take off our boot covers. And again, we're starting from dirty to the cleanest. Here's where this second pair of gloves comes in. At this time, I'm going to ask Kevin to take his outer gloves off, being careful not to remove the inner glove. And as we stated before in the previous video, take your normal size glove, one pair of those, add the next size up. In fact, maybe everybody should just be wearing extra large gloves if we're going to proceed this way. We can work that out administratively. So with that, we talked about earlier, these gloves should be clean. There's no holes in them. If there's a hole in them, we'll have to adjust. But for the most part, these gloves are clean right now. Kevin should be bringing clean gloves up to his face. That's why we ask that people are wearing the second layer. We want to emphasize some points here. This is a very important part of the doffing. You're getting close to your face. Again, this mask is full of potentially infectious material. We want to make sure that we take our time and do a great job here. Your gloves should be clean. Remember, outer gloves came off. You're to the point where you should probably be, again, contamination should be minimal, but those are the routes of entry. We want to be very cautious with these. So what we're going to do, we're going to start out, we're going to take our goggles off first. Leaning forward, trying to keep that away from the face, using gravity to get it away from you. Again, we're going to drop that in the bag. These are disposable. These are low cost. They're $1.50 a piece. We are not at the point where we're rationing PPE, but again, we may have to do that in the future, so we may set that aside for decon later. Next thing we do is you take off the mask. Again, avoiding any contact with the front of the mask. Very important. You'll see Kevin's taking the bottom strap off, gently letting that kind of drop down. Next thing we're going to do, we're going to take the top strap. Using gravity again, we're going to let that just fall away from the face and into the bag. Perfect, Kevin. Thank you. Like we've said on numerous occasions and some memorandum that have gone out, the situation is very fluid. Equipment needs have been voiced. We're not quite sure what we're always going to get for equipment. We may end up with suits. We may end up with gowns. We may end up with just the Tyvek coats that we have now that we've already issued everybody. We do have a small supply of Tyvek suits, so we kind of want to go through how to make sure, how everybody can make sure that they're putting this on appropriately and then doffing it appropriately. A little bit different, same principles apply. You want to keep the bad stuff or the ugly stuff out of your suit or off you. Maintain that objective, maintain barriers in place and distance, time distance shielding. We want to continue to do that. Just because you have a suit on, don't get in there. Just because you have protective garments on, you don't want to just get up in somebody's face unless you have to, okay? Try to minimize your distance. So Kevin's going to go ahead and don the suit. We've gone through this a couple different ways, or we've suggested if you want to put the boot covers on first, that may work. It's probably just as easy to put it on over your boots. You're in a clean area when you're donning this, so finesse doesn't matter too much. Just make sure you get it on and that you don't put holes in it. One of the reasons we were reluctant to just buy suits is the variation in size and the potential for tearing and ripping anyway. We thought timeliness and being able to put an outer garment on to get that on was probably more appropriate. But again, we're not sure on what PPE we're going to have from this day forward through the duration of this emergency. So Kevin's now going to go ahead and he can grab the table or apparatus. We've talked about that. You're clean right now. You can lean up against some of these items. And again, when you're doffing, if you're next to an apparatus and you happen to lean up next to it, that can be decon. That's a metallic object. We can use sanitizer. We can clean up. So don't risk falling over just to doff this appropriately. Go ahead. Now, Kevin, we're going to go back to the idea of having an outer pair of gloves. We believe this is going to pay some dividends in the future, just being able to have that clean barrier under your primary gloves to make sure that if you've got something going on, as you approach your face in the doffing process, you're able to avoid any cross-contamination to your face. Hopefully we could try to get some type of longer cuff glove to get up over the suit. I know in the hazmat world, we generally try to avoid doing that because if you don't seal this with tape, if you get something running on you, it's going to run right into your glove. Again, there's no definitive answer on this. I believe based on what we're dealing with and the quantity of it, unless you have gross contamination, you're probably better maybe trying to tuck the cuff in. There is nothing wrong with having the cuff over. As you can see, if Kevin were to get exposed to something, some type of liquid or something, it would run off this and over the glove as opposed to running down into the glove. So we can debate that at a later date, best practice, but for now, there's no definitive answer. CDC recommends pulling the glove over the cuff. Kevin's going to go ahead and don the N95 mask. Again, like we said, slow is fast, take our time. Make sure this stuff is done right. Press fit. Okay. If we have leaks behind the mask, we have the ability to, N95 has a pretty good filtration rate on there, and if we start to breathe, the path of least resistance is going to be any leak around the seal, so we want to make sure that we got a good seal. And again, we will be fit testing on these masks to make sure everybody's good to go. All right. That's the, what we would probably call maybe a level C type of ensemble. Probably closer to a level D because we're not wearing a cartridge type respirator. But okay, we're going to move into doffing this now. A little bit different. Again, this comes from the hazmat world. We're going to do what's probably or most often called a dry decon, and we're going to have the biggest bag we can get. And the responders, our folks, are going to step into the bag. Okay, we'll step into the bag. Again, barring any liquids or anything on you, that we want to decon or wipe off with something so we can keep it collected and throw it in the bag while we're doffing. That's something we may want to consider. If there's gross contamination, we may want to just keep that from being able to be flung around. Let's soak it up, blot it with some type of towel, and throw it in the bag. Okay. As we start to move, we don't want to be slinging body fluid or phlegm or anything like that out around. Okay, phlegm, technical term. Anyway, so again, you're going to have a partner with you with some level of. My recommendation is that you've got at least gloves, eye protection, and you probably should have your N95 mask on. In fact, yeah, you will have your N95 mask on if you're helping somebody get ungowned here. So go ahead. Keep in mind that the person wearing the suit does not want to touch the inside of the suit. They're okay to start, the zipping process or unzipping process. I will help, for the most part, try to get out of the sleeves. I'm just here to steady Kevin to make sure he doesn't fall over, but also provide him with the ability to draw the suit down so that only the interior of the suit is touching his clothing. We want to actually roll the suit down around itself. So we'll keep doing that. Kevin can touch the outside of the suit. If I have clean gloves on, I will touch the inside of the suit. Mind you, if I touch the outside of the suit, I can't now go and touch the inside of the suit. Okay. All right, next step. Kevin is going to reach down and in one motion attempt to remove his boot covers and the remainder of the suit. Easier said than done. And simply step out of the bag away from the suit. This one's going to be a little bit easier. You can gather the material as needed to move it into the bag. Your assistant can certainly help you with this. And again, you can see Kevin has some skin touching the bag. He's touching the inside of the suit. Okay, things should be relatively clear right now. Now avoid trying to get the bottom of the boot cover on your hands or your gloves. Okay, so we'll then gather this up a little bit, kind of keep it contained, pull the outer pair of gloves off. Okay. And now what we're simply going to do is go back to what we did before. We're going to doff our facial protection, or our N95 and our eye protection, doing exactly what we said we'd do before. Again, slight lean forward, take the mask off, let gravity be your friend, drop it into the bag. Bottom strap appears to be the best way to take, the first strap to take off first. And then up a little more, Kevin. There it is. And then using gravity so we don't flip that mask around the face, just kind of let it fall into the bag. Okay, Kevin's now going to move into, we already talked about this so we won't review it again, but Kevin's going to doff those internal gloves, put them in the bag, throw another pair of gloves on, and then try to make sure that we tie up the bag without creating any type of airflow up into our face. Okay, we can share bags if we have to, but everybody has a kit with their own bag in it. I would suggest you just do it that way. Okay, next steps. Right now, before we even get in our apparatus, we're going to do some personal decon. We have waterless hand sanitizer that we will use. We're going to wash our hands off with that before even getting into the truck. Be mindful of anything you might have on you, potential exposure to body fluids or anything like that. Proper PPE, proper distancing should probably virtually eliminate that unless you're doing a high-risk procedure such as a king tube placement or you're doing you're bag valving the patient or something like that. So should be in good shape. Decon equipment on scene if possible. Gross decontamination, remove that, get that cleaned up from there. These types of incidents need to be documented as a contact. Proper PPE in place without exposure is a contact. It's not an exposure. Those will need to be documented through an email to my office. The other part of that is making sure that the NEPSIS patient record and the EMSR's reports, narratives, identify that this was a potential contact for COVID-19 or whatever virus may be there. Exposures need to follow our exposure control plan. That's the best tool we have right now to do that. Again, there will be reporting on that, and we will talk about how to manage our people from there. We'll have to evaluate the risk of infection. We'll do that through a process with some of our partners in the community, Holland Hospital and Health Department. There'll be more to come on that later with some direction on that as well. So get out there, be safe, wear your PPE. When in doubt, wear your PPE. Good decon is imperative. We've got some procedures in place at the stations. We want to make sure that we're cleaning stations on a regular basis. And again, when you are off duty, we're recommending, like we do to any general public, stay home, stay away from big crowds. I know that's tough, but we want to make sure that we minimize our exposure and what we may bring back to work. So again, we'll get through this. This is a good challenge for us. We've all trained to do this, and that's why we're here. So if you have any questions, make sure you seek myself, Kevin out. Brett Grundyke will be another contact to look at, and Anthony Van Huysen, our EMS coordinator. So again, thanks.